Second wave, new approach, will it work? Emmanuel Macron bracing French citizens for 6 weeks of a 9 p.m. to 6 a.m. curfew in 9 metropolitan areas, including Paris, with COVID patients taking up more than 40% of intensive care unit beds in the capital. Was there really a choice? And how will it work? The idea is to stop the top cause of clusters, private events, and family gatherings. It's no longer a nationwide lockdown like back in the spring. Schools will remain open, working from home won't be ratcheted up to full throttle, and families can still travel for the upcoming school holidays. Too much or not enough? How to enforce it, and what will be the unintended consequences? It's not just France, but all of Europe that's figuring it out as we go along. Over in Liverpool, the last night of bars open was on Tuesday before a partial lockdown resulted in venting by revelers, angered by the prospect of a return to isolation. How to address their fears and federate citizens around restrictions that go against, well, our nature as social beings, as human beings. Today in the France 24 debate, we're looking at France's COVID curfew. With us, Dr. Viviane Covès-Masfety, professor of public health at McGill University and at Paris Descartes University. Thank you for joining us.
Thank you. Hello.
We also want to welcome Olivier Boraz, director of Sciences Po's Center for the Sociology of Organizations. Welcome to the show. The latest publication you've co-written, COVID, an Organizational Crisis. Okay.
Thank you for having me.
You're going to go Marie Kondo on this with this. All right. Many thanks. From Edinburgh, Dr. Alison Pollock is professor of clinical public health at Newcastle University. Thank you so much for joining us.
Good evening, and thank you for inviting me.
And always great to get the insights of columnist and communication strategist Philippe Moreau-Chevrolet, president of MCBG Consulting. How are you?
Hi, very fine, Francois.
The France 24 debate on Facebook and Twitter, hashtag F24debate. Yeah, everybody home at 9 p.m., says the Prime Minister. And after the president's Wednesday night interview, specifics spelled out by the French government. Monty Francis has that story.
Starting Friday night, it will be closing time in the French capital and 8 other cities that have seen a rise in COVID infections. The French Prime Minister spelling out a strict set of rules for the curfew in effect between 9 p.m. and 6 a.m.
Cela signifie qu'à 21h, chacun devra être chez soi et que, sauf exception, tous les lieux, commerces ou services publics recevant du public seront fermés. Comme pendant le confinement, certains déplacements resteront autorisés.
Those exceptions include going to and from work, caring for a loved one, traveling by train or plane, or walking your dog. Indoor gatherings are limited to 6 people. That means a ban on private parties and even weddings. President Macron explained the reasoning during an interview Wednesday night.
Notre objectif, ça doit être de réduire les contacts privés qui sont les contacts les plus dangereux, qui est souvent des moments de convivialité, il faut bien le dire, c'est ça qui est cruel dans la gestion de cette maladie, des moments où on risque de s'infecter parce qu'on va être trop proches les uns des autres pendant une certaine durée.
Restaurants must abide by the curfew and limit customers to 6 per table. Also, the well-known permission slip or attestation is back. Just like during the lockdown, it must be timed, dated, and signed, available to download from a government website or available on smartphones. Police will be out in force to catch those who don't comply. Violators face a fine of 135 euros for a first offense and up to 3,700 euros or a 6-month jail term for repeat offenders. The curfew will be in place for at least 4 weeks and could be extended if the number of coronavirus cases continues to rise.
Viviane Covès-Masfety, were these the right level of measures at the right time?
What a simple question you are asking to me. I think everybody is trying to find the balance. Personally, it seems to me appropriate. Anyway, we have to do something, at least in the Parisian area, where the number of cases are going fast, very high. And it is true that the social meetings and the social private occasion are the places where the people get infected. That's true.
Olivier Boraz, we saw a French president Wednesday night who admitted that we got some of this wrong back in the spring. Your thoughts on what he announced?
Well, I was a bit surprised by the fact that he said we drew the lessons from last spring. We've learned from the management of the crisis, and still repeats decisions that are very similar in nature. The curfew is very similar to the lockdown in many ways. I mean, it's a decision that has never been planned before. It relies on no empirical basis in terms of scientific research. We don't know how it works, what results it produces, intended or unintended. In both cases, these are decisions taken in the heat of the moment, without anticipation. So I mean,
but do you accept his premise that the number one reason why the cases are shooting up is private gatherings, is the fact that
I'm not sure about that. I mean, I don't know. I mean,
partying and
I'm a sociologist. I mean, I'm not an epidemiologist, so I can't. I mean, I see the data, but I see there are many controversies between scientists as to where the contaminations occur. And personally, I don't feel that there is a solid scientific basis on which these decisions are taken. There is this idea that it's young people that are responsible for this. They're an easy target, but this raises many questions as to will this work and how will this work. And I'm not convinced that this was the appropriate measure to be taken.
Viviane Koves-Masfetti?
I am an epidemiologist, and I am much more convinced. I think, okay, we may not have so many French studies, but we have some. And we have some data, and I think it makes sense. For me, it makes sense, yeah.
If I beg to differ just on one point, it's the fact that maybe we have some studies on where the contamination occurs, but we have no studies as either on the lockdown or on the curfew as to is this the appropriate measure in terms of public health. These are not public health measures. They're order, security measures. They're not public health. So we don't know if they will work.
At least we have tried that in Guyane, and we have tried that in Mayenne, and there have been a follow-up. So,
yeah, the French government pointing to the fact that in French Guyana they had these curfew measures, same as in the eastern French city of Mulhouse back in the spring, and a little bit, in Brittany and Mayenne. Alison Pollock, your thoughts, because, we don't have years and time to do long studies to prove what works and what doesn't. Your thoughts on the French approach right now heading forward?
Well, we have a copycat approach going on right throughout Europe with curfews and lockdowns to the extent that everybody is now shielding. But we have absolutely no evidence to support this and that it will actually work, or whether these measures are being brought in after the event, i.e. after the next phase of this epidemic is over. And I think it's really difficult because what's happening now is we're doing an awful lot of testing. In the UK, we're doing 250,000 tests a day, but France also is doing a huge amount of testing. And this is really confusing the picture, because the tests are not a test of infection or even of infectiousness. So this is a real problem when you start to trigger lockdowns on the back of tests that aren't really telling you very much about who's infected or infectiousness.
What's triggering these lockdown measures is the fact that you're now up to 45% hospital beds occupied, intensive care unit hospital beds, by COVID patients in the Paris area. What's the alternative, Alison Pollock?
So I think we have to look very carefully at the definition of cases and hospital admissions and who's occupying beds. Certainly in the UK, we had many people, our threshold for admitting patients is very much reduced. So many patients were dying at home in March and April and not receiving the care they needed. We weren't admitting older people, we are now. And also, the criteria for who's in an ITU bed has changed. Many of these people are not on ventilators, which is what people think they are. They're on CPAP, or they're on, having oxygen. So I think we have to be very careful when we're trying to interpret what is a hospital admission in a case. Because many people who are now testing positive in hospitals are as a result of what's called nosocomial infection, but may not actually have COVID as their primary cause of admission. It may simply be that they're testing in the hospital with COVID.
Either way, though, the hospitals are swamped.
Well, I think we've got to be very careful in how we're interpreting these data and asking the questions. That's all I'm saying. I'm not denying that there isn't a second wave happening, but we have to ask, what are the definitions of cases and admissions and deaths? Because they've changed enormously in the last 6 months, and I dare say they've also changed enormously in France as they are in Spain. And are we actually putting in all the other protective measures that we should before resorting to very harmful lockdowns? So have we put in the staffing that we need around long-term care, around domiciliary care, and all of those other measures, which are much more important in many ways than the lockdown? Because you can't carry on lifting up, putting on lockdowns forever. So I think we need a very public debate and discussion on these data and what they mean, especially when deaths are not rising anything like the rate that they were, in March and April. So we have to be very careful about how we interpret the data and what's actually going on. That's all I'm saying.
All right. Just very briefly before I turn to Philippe Moreau-Chevrolet, Viviane Koves-Masfeti, we heard the Prime Minister answer a reporter's question on that, saying it takes years to hire staff. Is that a valid point?
The first point I would like to mention is that concerning the interpretation of the statistics, the criteria to hospitalize people and so on, I think it's very important when you are comparing different countries between themselves. Because, each country has really its pattern, its insurance system, its way to finance. Some of the countries are very localized, some others centralized. So, the international comparison, we have to be careful. Now, to come back to your question, of course, you have to have time for training people. If you are talking about doctor, it's a long time. A nurse is maybe a little less. However, there are ways to delegate some tasks, and in fact, it has been the way people were adapting.
Philippe Moreau-Chevrolet, do you feel like we're in a rerun of what happened in the spring in terms of the crisis management?
Yes, very much so. And the French the French doctors are saying that it's even worsely managed than during last spring. We don't understand why they were producing the same mistakes, waiting until the last minute before they react, waiting until the last minute before they do implement strict measures. And they don't seem to appear to be grasping the reality of the situation in the hospitals, on the field, until it's a little bit too late. It's distressing for the whole of the population.
Why is that?
Frankly, I don't know. We have very good doctors. We have a state that is running. If you take one example, the economic situation is really very well managed. We have an efficient way of dealing with companies that are in trouble right now. It's smooth. It works very well. But apparently, when it comes to public services that are not really profitable, like the health services or the education services, then the government doesn't seem to be able to manage them efficiently. We don't have enough. We didn't even prepare the schools for what is currently happening. So we had to cut the attendance at the universities by 50%. From one day to the other, without any preparation, without any budget, without any additional funding. just because it wasn't planned in advance. So it's very much like we have a very...
But in fairness, Philippe, all of Europe's improvising, isn't it?
What?
In fairness, isn't all of Europe improvising?
It's true, but it's not... the threshold for alarm is not the same. Okay, in Germany, they are maybe at 1/10 of our current situation and are taking harsh measures. And it's the same in Italy and everywhere else. But in France, we have been waiting for 20,000 cases per day before we start to do something. And every expert in the place, every people that is a little bit even remotely concerned by the virus, have been telling the government that it was time to act. We have been saying that for 2 months now. Even our Minister for Health have been saying to the government and the president that it was time to act, and they didn't. And why didn't they act? We don't know. But now the anger is really, really strong. And, it's people are scared and angry, and it's not a good combination.
All right, scared and angry. So will they follow the precepts of the government? We'll ask our panel when we come back. You're watching the France 24 debate. Welcome back, or welcome if you're just joining us. It's the France 24 debate, and we're wondering if it's a repeat of what happened in the spring of France announcing a 9 p.m. to 6 a.m. curfew for 9 metropolitan areas. This as measures are tightened throughout Europe. The Campania region in Italy announcing that it's closing schools for a couple of weeks. We've had tighter measures in Poland announced this Thursday. It's across the continent. And we're talking about it with Dr. Vivian Koves-Masfeti, epidemiologist, also psychologist, and psychiatrist, excuse me. Professor of Public Health at McGill University and Paris Descartes University here in Paris. We're also in the company of Olivier Boraz, director of Sciences Po's Center for the Sociology of Organizations. You teach at the prestigious French Political Science Institute. I see you're wearing a sticker that says Free Fariba. Remind us who Fariba is.
Fariba is a colleague at Sciences Po, French and Iranian, who has been held prisoner. And
you almost said hostage there.
Well, I want to, yes, it's because the French government last week, when the hostage was released from Africa, declared that there were no more French hostages in the world. Well, I beg to differ. There is a French hostage in Iran for the moment. And so today at Sciences Po, we had a big mobilization in support of Fariba to get her out of Iran as soon as possible.
All right. And we want to welcome back to the show from Edinburgh, Dr. Alison Pollock, who's a professor of clinical public health at Newcastle University, and Philippe Borot-Chevrolet, communication strategist, president of MCBG Consulting. In his remarks on Wednesday, the French president saying it's hard to be 20 in 2020. Young Parisians adapting to the new normal with this curfew that's targeted straight at them.
Une dernière règle, cette fameuse règle des 6. Au restaurant, on l'a dit, je remercie une fois encore nos restaurateurs, on a dit pas plus de 6 à table. Eh bien, au maximum, pour notre vie personnelle, il faut qu'on fasse ça. Si cette règle des 6, qui est une règle de bon sens que chacun peut avoir, il faut essayer de se l'appliquer à soi-même, parce que c'est aussi quelque chose qui nous protège et qui va nous aider à freiner France entière tout cela.
Yeah, talking about the rule of 6, which is akin to what was announced a couple of weeks back in the UK. Philippe Borot-Chevrolet, the French president there, he didn't say that was an order from the top. He was saying this as something that was advice, if you will, this rule of 6, the way it was described. And it didn't get picked up as a commandment from the Prime Minister when he spelled out specifics this Thursday.
No, it's a new kind of sanitary measure. It's the recommendation to do something properly, but we won't enforce it by law. They are very much afraid that the French population would react badly to any strict measures, and that the anger would turn into open rebellion. We've seen that in Marseille, in the south of France, for instance, and there was an open rebellion on the part of the local officials that didn't want to hear about any restrictions. So they are kind of, they are cautious because they know the population is really exhausted from all that, and really want to change in a way from that situation, a change that we won't get until a very long time. The president said that we would be out of it by the next summer, but that anger, it builds up, and so they know that they have to be cautious, and they have to adopt measures that would be kind of friendly in a way.
Kind of friendly in a way. Viviane Coves-Masfety, again, how much do you impose upon people, and how much do you say is something that you're asking to do voluntarily? He called in his remarks on Wednesday on people to adhere to citizenship values.
Yes, because one of the problems is that people are not following recommendation. I mean, I am taking, for example, public transportation, and it is obvious that, let's say, 1 out of 10 people will not wear his mask in a proper way. Some of them will not wear at all. And it's noticeable that people are not following the rules so closely. So you have to do something. I think he do what he could do. It's not so easy to make a discourse as a president and try to persuade the people to obey to something. We're not maybe in a country where people obey so easily. And as you know, we are one of the countries who distrust so much the orders. I mean, for example, we are the highest country in terms of anti-vaccination. The rate in France of the people opposed to vaccination is higher than in any other country. There is a distrust toward public health.
Has COVID changed that at all?
I don't think so. It's a debate, so I will be happy to have somebody to disagree. But I am very surprised to see so many people who say if there is a vaccine, I will not take it. Which is really even the actual flu. Because, actually, we are starting the regular flu vaccine campaign. I'm not so sure that people will rush into.
I mean, I don't really agree because, early March, we didn't expect the French population to be so observant of the measures, the lockdown and then the masks. And actually, they did follow the rules. I mean, they were very observant. I mean, much more than expected, much more than other countries. I mean, you have protests in Germany against masks, which you don't have in France. And yes, there are some people who don't obey, but the vast majority of the people do obey, do follow the recommendations. And so pointing to the behaviors as a problem, I think, is a mistake on the part of the government. I think there are other ways of tackling the problem than trying to shape behaviors. It's the easy way for the government, but it's not the appropriate way, in my opinion.
All right. And this idea of do you get people to adhere to it or do you order it is a problem across the channel. It was last orders, speaking of orders, in Liverpool on Tuesday. Revelers in the city centre pouring into the street and in one instance venting their feelings on a passing police car. And even though intensive care beds were at 95% in the city, locals by the River Mersey wondering why only them.
Just think the lockdown should have happened, like it did in March, everywhere shut down.
Nationwide?
Nationwide, yeah. For at least 3 weeks and get the country back on its feet again.
Alison Pollock, your thoughts on Liverpool being one of the first cities to go back to, well, effectively what's the same as what we're seeing in the Madrid area, which is nearly a return to full lockdown?
Well, one of the big issues is the effect of lockdown on the local economy and on increasing poverty and inequalities. the UK has not been as generous, perhaps, as France, and we're seeing rising unemployment, although we have got the furlough system. And people do feel very angry, and they're very, very frightened because they know that many of these businesses will never start up again. So, the big issue is that most of these public health interventions, whether it be curfews or masks, have never been properly and formally evaluated in the real world. And that's quite disgraceful because the government has had an opportunity in all countries over the last 8 or 9 months to do the evaluations, to see whether these interventions actually do make a difference and what are you going to be measuring. So it's a very easy diversionary tactic. The government is now putting the responsibility back on the population again, because it's actually, in the case of the UK, it's failed to play its part. It failed to protect older people. It's failed to build the capacity in public health that we needed, and we've had a huge privatization. It's failed to build up primary care, and it's failed to expand the hospital capacity that we need.
But that's not going to happen. It's not going to happen, though, in the space of 6 months, is it? So what do you do now if you're the government?
No, it could have been happening. But I think this is why it's really important that we're actually looking more carefully at the data, because I've just looked at the French deaths and it's not up hugely for COVID deaths. You're about the same level as the UK. And you have to put that in the context of all the other deaths, which are many, many times. You're probably about 2 or 3% of all deaths are due to COVID. But we mustn't take our eye off all the other causes of illness that's happening when we're just focusing on COVID. And that's one of the problems. We're trying to do COVID-shaped solutions when we really should be looking right across the board at all the other things that are happening to people in their lives. Illnesses, poverty, unemployment. Because actually poverty and unemployment and housing are the things that fuel the disease. They contribute to the disease. They don't actually help cure it.
In the last 24 hours, numbers just in at this point, Olivier Boraz, another 88 deaths, according to the government here in France, linked to COVID. Again, it's hard for us to put this in perspective.
That's precisely the problem, I think. I think what the government should be doing, and I agree with what Alison has been saying, is to put this into a larger perspective. And this, for the moment, the way the problem is framed, it has been framed in March and is still framed today, is really focused on hospitals and number of deaths of COVID. But that's not the only way of approaching this issue. There are other sources
such
of
as
illness. Well, there are other sources of illness and deaths. Why put all this investment on COVID in hospitals and not on other diseases, on other sources?
Because if we don't keep a lid on it, then it runs rampant.
Many other things run rampant. There are many other sources of death at the moment. And the consequences of the lockdown measures have never been really truly evaluated. But we know that the economic, social, and sanitary consequences, costs of these measures will be extremely high. So I think I'm not saying we should stop. I'm saying we need to have a debate on whether we should continue focusing on this single disease and on hospitals, or whether we should get a bigger picture of the public health issues and see what role we want this specific case to have in this wider picture. I think that's the real concern. And no government is doing that at the moment, except maybe in Europe, the Swedish government, the Swedish authorities. They're the ones having the bigger picture in terms of public health. But the other countries are not doing that. They're focusing
with a mortality rate much higher than their neighbors when it comes to COVID.
Yes, but that doesn't mean anything at this time. You're comparing things that are not comparable. Let's look at the other causes of death and illnesses in those different countries over the period, and then we can compare who did the better job.
Viviane Coves-Maspetti?
I disagree. I disagree. I think, first of all, the question of death is very complicated because, as you know, COVID has a secondary effect on all the cardiovascular system. So people may be recovering from COVID and then suddenly die from a heart attack or AVC. So, it's clear that A stroke. So it's clear the things are very complicated. The second point is that I don't want to defend the French policy more than it should be, but if you look at what has been said, there is a huge part concerning economy, trying to compensate what they call the partial unemployment. So, you know, they try really first to compensate, then to have public measure. I mean, you know, just to say the people to wash their hands and to stop going close together and to stop having large family gathering is totally public health. I just want to say something. By chance, I was looking at a video concerning Wuhan in China. And I am working with China for doing a survey in mental health. And, you know, so I have personal contact with people because, you know, everybody will see the data from China as suspicious. But what is true is that today in Wuhan, they are living normally. And same in...
Because the lockdown was radical?
That's a very good question. I mean, you know, what is interesting is with human resource, they do not have a vaccine. I don't know what about their health curing system, but, you know, I'm not sure they are at least much better than in Europe. That's the minimum statement. They did it. I am not saying we should do the same thing. We are not the same people. We do not have the exact, you know, it's not my point. My point is, in terms of public health, there are ways to stop it.
All right. There's then the issue, and it's been playing out here in France over the past couple of weeks. We had 9 metropolitan areas that are under the weight of this curfew measure announced by the government. At the beginning, when the tighter restrictions began, first it was Marseille. There's a bit of a rivalry with the capital, Paris. It doesn't exist just on the football field. The same is true over in the UK, where the north of England, to quote the mayor of Manchester, feels like it's the canary in the coal mine. On Tuesday, the leader of the Labour Party argued not against lockdown, but instead for a nationwide lockdown, a so-called circuit break timed with the upcoming school holidays, as is planned in Northern Ireland.
This would not mean schools closing. But if it happens imminently, it can be timed to run across half-term to minimise disruption. But a circuit break would require significant sacrifices across the country.
The whole point, Mr. Speaker, is to seize this moment now to avoid the misery of another national lockdown into which he wants to go headlong by delivering a regional solution.
So, Alison Pollock, should it be all or nothing when it comes to lockdowns?
Well, again, we're coming now to politics, and this is all about politics between the parties, really. And unfortunately, the doctors themselves and scientists, some of them are engaging in these political polarization. We have absolutely no evidence for this. And in fact, in London, really, it looks like immunity may have been reached in many parts of London because we're not seeing this enormous second wave happening. And it's almost as if the virus is finishing its tour of the country, going to the places in the popular arts that it hadn't reached previously, or that had been either locked down early before the virus took a hold. So we really just don't have enough to advocate a circuit breaker or a national lockdown. What we're doing is we're relying on modelling. But if you actually look at the death data, it's really not changing hugely. It's not going up dramatically in the way that it did in March and April. And that should really be reassuring us that we're doing some things right at the moment. And France and England in the UK are very similar that way. COVID deaths aren't rising dramatically. And also they're a very small percentage of all deaths. And so we now need to monitor carefully the excess deaths. And, you know, you have to remember that when you do a lockdown, you are also hurting people, you're denying them access to other sorts of care that they need and creating a lot of mental and physical distress and disability as well. So these lockdowns can have unintended consequences, not just on the economy, but on the health and the access to health of your population. So we have to be very careful and very considered. And we also have to know how we're going to evaluate them. What is the measure? How are we going to evaluate whether it works? Because we don't know whether we've brought the lockdown after the event, after the epidemic, the second phase is beginning to fall again.
Of course, making policy is done by politicians. So let me turn to our politics junkie on this panel. Philippe Moreau-Chevrolet, when I listened to the reaction of opposition politicians to the French president's speech, I mean, there was criticism, but overall, there isn't a huge divide, the kind we just heard there, between the leader of the Labour and the Conservative Party. In France, would you say that people are more in favor of, well, sort of a zero-risk culture when it comes to COVID?
Yes, and we've been through denial for a long time. We've been through, this opinion that the virus would disappear, that we would reach immunity in Paris because we had so much in Paris already in terms of death and contaminations. We've been through that phases, and now we know that there is no immunity that could be reached. And we see that in Stockholm, in Sweden, for instance, the virus is taking on again, and obviously the model is a failure, and it just didn't work. So people are kind of, okay, getting that it won't be quitting soon, the virus. We have to live with it, and we have to fight against it. And of course, we want strict measures in order to get rid of it as soon as possible. It's like we've been educating the people on health issues. And I just want to say one thing is that we do that not for the sake of preserving lives. We do that because if we don't fight against this virus, we won't have a public health system anymore. We won't have the ability to cure cancers. We won't have the ability to cure even the single cold because we will be overwhelmed by these cases. So it's not about preserving lives. It's not about calculation between cancer death, COVID death, AIDS death. It's not that kind of thing. We are fighting against a virus that could kill our health system, and we are fighting to preserve this health system because in Europe we have elderlies, a lot of elder people, and we don't want to crush the health system because we need it. And we don't want to turn into a land where there wouldn't be any doctors available when you have an emergency. And we lived without any emergency doctors in April when it was so overwhelmed that the emergency services couldn't be reached over the phone. That's the truth of this virus. We are not fighting against anything else. If people don't get that, soon it will be too late.
All right, disagreement, I know, on the panel when it comes to this, but I want to bring up one final point before we go, and it pertains to something we heard from Alison Pollock, Vivienne Kovesmes-Feti, which is, the psychological impact on all of us. There were a lot of long faces in the office. This returning to, we thought maybe, okay, we knew there was going to be disruption when school started again and when people went back to work. We knew it, but when we heard the French president say, look, it's going to be like this at least until next summer, it takes a toll on people mentally, doesn't it?
It's amazing because when we had because we are talking about lockdown, but actually we are in a curfew. We are not in a lockdown. I mean, and I think we are talking about, in terms of psychological consequences, we are talking about two very different things. So what amazed me is that when the lockdown started, I was called by journalists saying, lockdowns, that should be awful in terms of psychological reaction and so on and so forth. And they may have PTSD, post-traumatic stress disorder, because of the lockdown. Then when the lockdown terminated, then the journalists call again and say, it should be very awful because the lockdown stopped and it is a new adaptation and nobody knows exactly what to do. And it's true that, the exit of the lockdown was a bit difficult because during the lockdown, it's maybe difficult, but at least everybody knew what to do. The rules were clear. Then after the lockdown, it was much more different. You know, people don't know if they could do that or not. I mean, you know, it was...
Either way, it's an upheaval.
It was, and it's make conflict between the people because their feeling about the risk were so different. So it's create conflict on that. And then now we are on the second wave, which is not... a novel, because, you know, everybody was forecasting that it will be a second wave. And then I think it's too much dramatized in the sense that we are talking about a curfew, which means that the life is nearly as normal.
Nearly as normal. That's ask 20-year-olds. Perhaps they have a different view of that. Unfortunately, we're out of time, but I want to thank you, Viviane Kovesmas-Fiti. I want to thank Olivier Boraz, Philippe Moreau-Chevrolet, Alison Pollock for being with us from Edinburgh. We want to thank you for joining us here in the France 24 debate.